So my name is Sigalle Reiss, and I'm the Director of Public Health and Human Services here in Brookline.
And how long have you had that?
I still feel like I'm fairly new, but it's been just about 2.5 years.
You came on during the pandemic.
I came on right about the end of the pandemic. So got the tail end of it, obviously dealing with the issues of masking and make sure, we have spaces and are separated from each other. But really, I feel like at the tail end when things were on the recovery.
Yeah. And you came from the town of Norwood.
Yeah, I served in the town of Norwood for about 15 years as a health director there.
What are the biggest differences between Norwood and Brookline?
Well, really, I came here with the excitement of really being able to do some really exciting public health, and we're going to get into that with this community health assessment. But population size, definitely bigger. Brookline's a much bigger community, much more urban community. Norwood is much more suburban, smaller business centers and downtowns. And I think also the diversity in Brookline is what drew me here. And working with diversity of views, diversity of races, diversity of, and again, the health assessment shows a lot about it, of, the foreign-born population is high. So really working with an interesting community was what drew me to work here.
Excellent. What has been your biggest surprise working in Brookline?
I have to tell you, to be honest, I didn't know I was going to be doing this much work with rats. Rats are everywhere, I will admit that, but in my 20 years of working in public health, I've not done as much work as I've done here. Which, looking back, we're in an urban environment, that's understandable. It's something that many urban environments are working with and trying to combat, and really a result of so many things, like we keep talking about, a result of how the pandemic has really changed our society, that we also saw changes in our rodent population behavior, which has, increased their activity in certain areas. Mm-hmm. So I thought was actually quite surprising to me. But a lot, I would say a lot isn't surprising, and there's a lot of, different town, same issues, that I think Brookline is not a bubble in any sense, that many communities are dealing with the same sort of issues around housing and daycare costs, and again, a lot of things that came up in our community health assessment here. But many communities are dealing with the same issues.
So let's talk about the community health assessment. What is a community health assessment?
So it's really the first step that a health department should be taking to set the direction and the priorities for the department and for the community at whole. I keep emphasizing that this is not a health department community assessment. It's a Brookline community assessment. And the next steps are going to be involving the community in the community health improvement plan, which is sort of phase 2. So it's assessment of the community. What are the priorities? What are the issues through the data that we gathered that rise to the top? And then we really worked through in a thorough engagement process to help prioritize. Because now we have all this great, amazing data in the assessment that really shows us where our strengths and where our weaknesses are. But what are we going to tackle first? What are going to be the strategies that we use first to start to tackle some of the gaps that we identified in the assessment?
So what are some of the things that you do in order to assess?
Yes, we did many, many things. Lots of different data sources in here. So the largest probably contributor to it is the Community Health Equity Survey, which we took advantage of the state survey that was going on at the time and really worked to push that survey out locally. So we had enough of a number, enough of an N to have significant data. So that was a huge factor in this, and you'll see that throughout the report that we drew upon the Community Health Equity Survey. And I should say we had great representation and great sample size in Brookline, so a lot of hard work.
Do you mail something like that out?
Because we had to work with the state structure, it did limit us on how we could distribute it, in that there was very little paper survey. There was opportunity to do a paper survey, but most of it was electronic. So really boots on the ground, going out, sharing the QR code, working with people with tablets and laptops to make sure that they could complete it, providing any assistance we could, working with the senior center and a lot of our community partners to make sure people had access to the survey. Because it was online, there's a lot of benefits to that too, not only in the data collection, but that it was able to be translated in many, many languages. Once you do a paper survey, obviously that's a lot harder to distribute in many languages. So because it was online, we did have the access to I think close to 15 different languages, which again, for a community like Brookline, talking about the diversity and all the languages spoken, that was a huge benefit for us. And probably something we wouldn't be able to do if we had just done the survey locally. We had a lot of discussions about whether to do our own survey in Brookline, or to take advantage of the state survey. And like many decisions, there's plus and minuses of going both ways. But I think one of the huge pluses was having not only the marketing that the state was doing also to sort of re-emphasize what we were pushing out, but to have access to it in many different languages and have some basic data collection and data cleanup done by the state too. But what we really had to make sure was that we had enough of a sample size. In many communities, even larger communities than Brookline, the survey wasn't received as well, or there wasn't as much of a push locally to get it done, and they just don't have the sample size to have really effective data. But I'm happy to say we were able to attain that.
So Brookline is about 64,000 residents. What's a good sample size?
Yeah, we had close to 500 residents answer the survey, and the diversity and it was a good sample size. The diversity of who answered it was also important. But I would say the survey is a big component of it, but there are many other things that we included, including the survey that is done in the schools every 2 years with the students. It's based off the Youth Risk Behavior Survey, which is a nationwide survey that many school districts administer in different forms. So we used a lot of that data to also inform this. And we used a lot of census data, American Community Surveys data, a lot of that publicly available data that's already out there. The state recently has done a really good job releasing other types of data. We were able to include information from the Bureau of Substance Use and Addiction Services, BSAS, and some of their data is in here. So lots of secondary and primary data sources. So secondary other data sources that exist and primary ones that we actually gathered. In addition to that, there's also a lot of qualitative data in here. So those stories, focus groups, interviews, there's a lot of that in here. So you get that first person impact to a lot of that big number data too. So we have the quantitative and the qualitative data that inform the assessment. Focus groups included different age groups, different economic status, different races, different language speaking. So we tried to, again, capture a diverse set of views in Brookline and combine it all in one assessment.
And you reached out to community organizations and had something at the Teen Center. Tell me more about that.
Yeah, so as we finished out the assessment and we sort of got a better picture of what are the issues in Brookline, what are the possibilities that we could work on, through that engagement process. The second step is really trying to understand where we should start working first. I mean, we all have limited capacity, limited resources, and so we need to prioritize. So, I thought there was a lot of community engagement in the assessment process. The engagement is actually even more valuable in the health improvement plan, which is the second phase of the project. I should say, this is overall a 2-year project with a community health assessment and community health improvement plan. And I was really fortunate to get ARPA funding to do this. So when I first got here, trying to understand the landscape in Brookline and trying to set a direction for the department and the community and what should public health be doing, it was key for me to get this CHA chip, we keep calling it. Of course we have an acronym for it. So it was during the time when the town was doing ARPA applications. So we submitted this, got some great support from the select board, really appreciate their support on this, and the committee that reviewed the ARPA applications, and we were able to get a pretty large chunk of funding to do this work. On the local level, it is really hard to do this work because it is very labor intensive. We do have an outside consultant that manages it for us, but there's also a lot of work within the department. So to be able to get that funding was really valuable for me, really being new to Brookline. And to have this type of information now at my fingertips is really going to set the department off on a good trajectory.
Awesome.
But so the second phase that we're involved in now is a community health improvement plan. And that's where we gathered a bunch of community members, representing nonprofits, different community groups and views, different departments within the town who are going to be vital to implementing this. And we wanted to see, what rises up to your priority. And we had a 3-hour meeting where we looked at all the data and literally just sat there and everybody voted on what they thought the priorities would be. And interestingly enough, of the priorities, we sort of created a new one, which we thought was overarching all of them. So the priorities include housing, mental health, access to social and human services. And then the fourth one was really about financial security. So we thought that the economic status and financial security was sort of overarching all of those. The cost of housing, the cost of access and care, all those were impacted by financial security. And then also, overarching theme throughout all this work, whether we're looking at the data and the assessment or where we prioritize our strategies, is health equity and making sure that we're really looking at where those disparities are. And something I knew, like when I came to Brookline, Brookline is a very healthy community. Everything that we love about Brookline is what makes it healthy. The access to public transportation, the walkability, the great restaurants we have, the great community connections. That's all great public health indicators. And we do have very good, when you look at our chronic disease rates, at our cancer rates, that we have very good outcomes. But in public health, we're always trying to find out where the disparities are. Who doesn't have access to those good outcomes, or who has poorer health outcomes? And how can we look to increase resources to those that have poorer outcomes? So being able to look at that data in depth and be able to parse out those disparities are also really important. And then we can deal with all the isms associated with that, because we're going to, in public health, again, we're always looking to go upstream and identify the causes of what are the poor health outcomes. And we know a lot of those causes are related to racism, sexism, classism, all those systems in our society that allow certain people to have privileges and other people have disparities in their access to, whether it be healthcare or access to physical activity. Whatever we're looking at, there's always going to be disparities. So with public health, we're going to look to remove those disparities or those barriers as much as possible. And that's what really the CHIP is going to look at. It identifies within housing who has access to housing and who doesn't, and why don't they? Is it because of financial status, or location, where you live? The number one indicator actually of your health outcomes is your zip code. It's not your DNA, it's not the healthcare you receive, it's actually where you live in that environment. And overall, Brookline has wonderful health outcomes. But again, when we look and start to break it out by different groups, whether it be age, whether it be race, whether it be gender, all those, you start to see disparities.
One of the things that was not a surprise to me when I was looking through the slide deck, Tommy Vitolo, our state rep, often says that we, I think, are one of the highest per capita, like very, very well educated in the entire nation, like per zip code. And also something I found out when I was on select board, we're heavier renters versus owners by a population. One of the things that surprised me, that I think you're alluding to, is that we have about 30% foreign-born residents, when the state average is closer to like 16%. Tell me about those indicators. Did anything surprise you? Did anything jump out?
There are definitely some things that jumped out and surprised me in the assessment. And some things that I don't think maybe might not have been surprising, but it's nice to actually see the numbers and how drastic it is. And I think some of those, and I'd love to pull through my tags here, because the data isn't quite all in my head yet. I think when we look at percent foreign-born, so just to compare, and a lot of times I think, again, what makes Brookline unique is the way, geographically, where it's located. I mean, surrounded by Boston on 3 sides, and then really only touching Middlesex County, but actually being in Norfolk County. So this makes our data comparisons sometimes a little difficult. But all in all, I think Norfolk County does represent, a good comparison for us. And also looking across Massachusetts as a whole. So whenever you're looking at data, you have to sort of compare it to something so you can ground it. Is that high? Is that low? Is that where we should be? But some places where we really stick out as being very different, either in a positive or negative direction, depending how you interpret the indicator. But for example, like percent foreign-born compared to the state and then to Norfolk County. The state is about 17%, Norfolk County a little under 20%, and we're a little over 30%. So that's a whole 10% difference. That's pretty extreme. And then also looking at the languages spoken in Brookline, a little different, where we see some similarities across the state and other counties. We see across all 3 categories, Chinese being the countries where people were born. China being the highest, and then, not surprising, Israel being number 2 for Brookline, followed by India, Korea, and Japan. So really a lot of Asian nations. And then, so I think some of those are interesting. I think also looking at our education attainment, this was a very stark difference when you compare it to the county and the state. And I am curious if we have the highest in the country, I don't know about the world, but I've heard maybe Washington, D.C. might be a comparison that we need to do. But I'd love to actually see if we are the highest. So in Brookline, education attainment, over 56% have a graduate or professional degrees, compared to the county, which is at 26%, and the state, which is about at 20%. So literally over a doubling of what Norfolk County has for education attainment. That is a huge, when we talk about sort of protective factor or something that improves your health. Access to education and a higher level of education tends to have better health outcomes in the long term. So we're thinking about those great things that are happening in Brookline. Very highly educated community. And even when we look at, bachelor's degrees, still tends to be high too. But the overwhelming, the one that sort of grabs you is that almost doubling what Norfolk County is for those graduate and professional degrees. Again, not surprising, but to see how large the difference is. Something that I thought was really interesting, which again, I kind of knew and it was actually talked about when I got hired here, and we were able to quantify it here, was about income inequality. And I think that does sort of connect to that education level. We have a very highly educated, very wealthy community, but not everybody has access to that wealth and that education. And it was interesting, so it's actually called the Gini index, and what it does is it quantifies the difference in incomes that we might see in a community. So we might have very high incomes, and we might have a lot of middle incomes, and then a lot of little income, less of in the lower income bracket. But in Brookline, the index is actually pretty large. Again, it's a ratio, but compared to it is higher than Norfolk County and Massachusetts. So I think when we think about income inequality and some of the disparities that might produce, Brookline has a high level of income inequality when we look at those very high incomes that we have in our community, but we also have a lot of very low income. And I think that comes out too when we look at our housing stock. We have multi-million-dollar homes, but we also have it tends to be we also have a lot of urban homes, a lot of homes that are that need to be repaired, a lot of subsidized housing, a lot of rental housing. But also rental housing is not the same. We have a lot of high, very expensive rental housing too, and that's creating disparities also. But a lot of subsidized housing developments. One thing that I also thought was really interesting, and again, I think what makes Brookline really healthy was the walkability. So the means of transportation, how people get to work. Why do people come to Brookline? Well, the education system is really good, and we saw that with the education attainment. But also the walkability, the easy access to public transportation. The more we can create physical activity in our regular daily routines, the healthier outcomes we're going to have. So having a very walkable, accessible community is going to have better health outcomes. But when you look at how people access work, about 23% use public transportation, and that's compared to Norfolk County, which had about a little under 12%, and across Massachusetts, it didn't even get to 10%, it was about 8.5%. So a lot of people use public transportation in Brookline, and that's a great thing. And then looking about what percentage of people can walk to work, which is even better, right? You're getting that physical activity just in your daily routines, was about over 15%. And you look at the small percentages across Massachusetts and Norfolk County, they don't even get to 10%. The county is at about 6% and the state is about 7%. So really good access to public transportation and walkability. So again, positive things that, we all know that's what makes Brookline great, but it also creates a healthy community.
Awesome. One of the things that I know we delved in when we were meeting, as nonprofit groups at the Teen Center was about mental health services and whatnot. And one of the things that I saw appear in the slide deck, and I remember kind of noting just personally, was kind of the question of, do you have somebody who could help you, like if you reached out? Do you have any, anything you want to say about assessing that?
Yeah, so one of the questions in the health equity survey talked about, do you have networks and individuals to lean on? If you needed to borrow money or if you needed to outreach to somebody. So I think those are great unique questions because it really talks about the connectivity in the community and your sort of individualized, your network of safety net. We think about safety net and providing services from either a nonprofit or government agency, but I think there's also the safety net of a community. And there were, again, compared to the state, higher numbers of people that had access to that sort of community safety net of reaching out to individuals within their network for help, whether it be to help find mental health services or help financially, that there's that connectivity in Brookline, which I think is a positive outcome.
Excellent. Do you guys work closely with the Brookline for Community Mental Health, Brookline Community Foundation? I know those are two organizations that not all other communities like ours have.
Yeah, I think Brookline has a real wealth of amazing nonprofits and community groups doing a whole lot of many different things. And many of those things fall under the large, not necessarily the Department of Public Health, but the larger public health lens of what makes a healthy community. There's some great initiatives at the Brookline Center for Community Mental Health, and we partner with them a lot. The Brookline Community Foundation does amazing assessments and gathers really great data that informs a lot of these efforts. But I think also looking like Steps to Success, Women Thriving, Brookline Thrives, the nutrition programs and the food access programs, the farmers market. I mean, there are so many different groups going on doing this type of work in Brookline. And what my hope is that we can all sort of start working in one direction and set some priorities. And that those are the stakeholders that are really involved not only in the assessment, but the community health improvement plan. Those people are in the room helping us identify the priorities and really working to address them. We want to make sure that we continue our great work in food insecurity. I think it didn't rise to the top of our priorities, which doesn't mean we stop doing the great work that's being done in Brookline around food insecurity, because there are amazing things being done. So we want to continue that work. I think that's a balancing issue with the community health assessment and the community health improvement plan. We don't want to remove any capacity or resources from the great programs that are going on, but we just want to build upon that and see how we can collaborate in partnership to create more.
Mm-hmm. We do a lot of work with youth here, and one of the recurring themes is their anxiety around climate change. I saw that mentioned, in a number of slides. What are some health impacts, outcomes related to those things? Anything that surprised you or got your attention?
Yeah, climate change came up as one of the topics, but then didn't end up in those 4 priorities that we identified for the action in the community health improvement plan. But one of the things that we're seeing is how we can interweave that into some of the identified priorities. For example, around housing. How can we interweave electrification, less reliance on fossil fuels in our housing? Because in the sense, that is also can be a cost savings. So how can we have those sort of win-win scenarios where we can also impact climate change and reduce the financial impacts of heating or whatever the reliance on fossil fuels. So really looking for those win-wins. And I think because of the people that we have in the room, these community stakeholders and community partners, that those are going to be underlying priorities that Brookline always has. So how can they sort of trickle up into our strategies and really address the strategies, but also keep those themes, spun throughout.
Awesome. So you mentioned phase 1 assessment, phase 2, the action plan?
Yep, well, so there's a lot of steps. There's a community health assessment, and then the phase 2 is a community health improvement plan. And then believe it or not, there's a year 1 action plan. I think, that's a lot of planning and producing reports. But for me, I want to make sure that it produces action. And I think, maybe it's that high education attainment level, I think a lot of us tend to be kind of data geeks, and we love to play in the data and really look at it and spend time with it. But the whole point of any of these exercises is to put it into action, into community work. Mm-hmm. So what I really want to make sure is we have that clear foundation and those clear priorities set, and everybody engaged in understanding their role in this work, so we can really take those actions on a community level. I think people really want to see community action. I want to be very careful, and I think I'm always careful. It's, my role is within government. I'm using public funds, and that we need to make sure that we have a transparent process and an engaged process to set those priorities, and then take those actions that we said we're going to do as a community. Mm-hmm. So I really want to make sure that we are producing it and then evaluating it too. So that's why, it is a 2-year process, and I always say nothing happens as fast as I really actually want it to be, but that I think we need to be patient, go through the process, have a very clear action plan, and then start executing it. And then honestly, evaluate it, and in 5 years, we should be doing this again. That this is sort of a never-ending cycle, that we do an assessment, we come up with a plan, we evaluate it, we execute the plan and then evaluate it, and then we are doing an assessment again because we want to show those improvements that we made.
What are some examples of actions that could be, I guess, agreed to and then implemented? And are you aware of any other communities that are further along in this process?
You're going to see places like Worcester and Boston do really thorough community health assessments and improvement plans. The way we deliver local public health in Massachusetts on the municipal level makes it really challenging for local health departments to do this type of work.
Because in a lot of places, it's county, right?
Yeah, most health departments across the country are at the county level. So, your sample size and your population is a lot bigger.
And resources.
And it's, interestingly enough, this one of our initiatives, and we have some funding from the state, is to try and think about what we can do on public health on a more regional level, collaborating with other departments. But it's very challenging because all of our governing structures are going to be on the municipal level. Our whole structural system, the way we operate, is on a municipal level. So as we try to expand regionally, there's only so much we can do when we're not all under the same sort of structure umbrella. Side note on that. But why I bring that up is because most communities do not have the bandwidth in not only the capacity of staff, but also the size population to do a really thorough community health assessment and improvement plan. It is a requirement if you want it to be nationally accredited as a health department, so you will see a lot of the larger municipalities and the cities really in Massachusetts do this type of work. And there's a lot of talk about how we might be able to do it regionally. Many of the hospitals, nonprofit hospitals, are required to do a community health assessment, but a lot of that, again, kind of goes regionally. We participate in it, but I think for Brookline, particularly, again, the geography of where Brookline is, a lot of the community benefits that come out of a community health assessment out of a hospital network tend to be in underserved populations and areas in their catchment area. So Brookline might not always get the benefit because our data is really good. Our health outcomes are really good. But again, if we start breaking it down by disparities, we do see some gaps, within our health outcomes. So I don't know of any other communities that have really, of our similar size, that have really done this extensive a community health assessment and improvement plan. I'm sure it's been done, but it's not something that is sort of required by the state, which again, why I was so thankful to get that ARPA funding to do this type of work, because this is really what makes a public health department effective. This is the work that we should be doing. It's very important to do our other work. We're out there, we're doing the food inspections, we're doing the housing inspections, our compliance work around permitting and licensing establishments is very important. We're out there doing communicable disease. We saw in COVID how important that is, but also community health and working as a community facilitator to really improve public health outcomes is really this type of work.
Excellent. I guess what do you hope to see, and how can select board or town meeting help in making sure that these actions happen?
Yeah, so as I keep saying, it's definitely a community plan. There will be a role for town government to play in that, and some of the strategies outlined in the Community Health Improvement Plan are around policy work. How can we make it more accessible? How can we think about structural racism and how that affects Brookline and our policies? So there is topics that I think will fall into the select board and town meeting. But I really want to emphasize that this is going to be a community plan. And the role of the health department, they will be sort of documenting and making sure all of our indicators and data are collected and measured, but that there will be many responsible parties. And that includes town meeting and the select board, depending on what the strategy is. So thinking about some examples, we talk about how can we work to support the Brookline Housing Authority, which is another great community partner that we had throughout this whole process. How can we support them in their initiatives to create more affordable housing? How can we look to work with businesses around doing trades and training with young people? How can we work with our economic development team in the town and our different community groups that represent businesses in the community, and how can we get some training to encourage workforce development? So it's sort of everybody working together is really what is going to make the plan successful.
Excellent. Is there anything that didn't get brought up that you want to slide in there? Because I think we covered most of it.
Well, we talked about definitely a couple of the data that we gathered on this, but there's so much in here. It is posted on the department website. We do have a thorough outline of the whole process that we took for the community health assessment, the different steps that we've taken, and also what we're currently doing with the community health improvement plan and those steps we're taking with that too. So it's all on the website, and it's right on, if you go to the health department on the front page, it's right on the left navigation bar. So we wanted to make it easy and accessible for people to find out what's going on with the project. And I would say throughout the whole 2-year project, there is a steering committee, which again, because we need those community voices. So we really tried to gather a diverse set of voices to really guide the process and to gather all those voices.
Excellent.